Hey guys, just following up in regards to our bleeding emergency series, I wanted to remind everyone we already have completed a quick disclaimer in regards to bloodborne pathogens and what you may be exposed to if a person starts to bleed. However, what happens when that bleeding emergency gets out of hand? First, you want to start obviously with a sterile gauze. You want to apply a few layers. However, just remember, you're not removing any of these layers. The blood by itself starts to clot and your body starts to heal itself. However, if the blood goes past these layers, then we apply quickly. We want to go to what we know as a pressure bandage. And you want to immediately apply that pressure bandage. Do not tug at it. You want to just allow those layers to pile up. But what happens once that pressure bandage is on and your patient continues to bleed? This is what we suspect to be an arterial bleed. Now, in this session, I'm just going to go ahead and talk to you guys real quick as to how to properly apply what we know as an improvised tourniquet. Yes, later on we'll definitely be connecting with everyone in regards to how to apply a commercial tourniquet. But here's my take. Please remember, in facility, we always use what we know as the commercial tourniquet. If you happen to find yourself outside in the community and you have no choice, it is important to know how to apply what we know as the improvised tourniquet. Here it is. When applying an improvised tourniquet, you want to immediately grab the cravat and you want to identify where the wound is. If it's bleeding in one end, please make sure to use the improvised tourniquet a few inches above the wound. We're using a cardboard box for the limb. You're going to go underneath with the cravat and you're going to make sure you create a knot. Fit 3 fingers underneath and immediately take a cylindrical or rigid object, long object, and go ahead and place it right onto that knot and create another knot. And then what you want to do is twist that long cylindrical object until you're able to make sure it is tight enough to stop the circulation for that limb. You're going to twist then around both ends of the cylindrical object and then create the knot underneath. Here are some images for the final product. Now, how do I know I've applied the tourniquet correctly? You are immediately going to check your radial pulse. As soon as you check your radial pulse, you should be able to determine that there is